There are various types of therapy interventions, each designed to address specific mental health issues and individual needs. Here are some examples. 1. Cognitive behavioral therapy, CBT. The focus is changing negative thought patterns and behaviors. An example is where a person with anxiety learns to identify and challenge irrational fears and replace them with more realistic thoughts. 2. Dialectical behavior therapy, DBT. The focus is balancing acceptance and change, and this treatment is often used for borderline personality disorder. An example is where a person learns skills in mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. 3. Psychodynamic therapy. The focus is uncovering unconscious motives and conflicts from past experiences. An example is where a person explores childhood experiences to understand how they influence current behavior and emotions. 4. Humanistic therapy. The focus is emphasizing personal growth and self-actualization. An example of this type of therapy is where a therapist helps a client explore their potential and work towards becoming their true self through empathy and unconditional positive regard. 5. Interpersonal therapy, IPT. The focus is improving interpersonal relationships and social functioning. An example is where a person works on improving communication skills and resolving conflicts within their relationships. 6. Exposure therapy. The focus here is treating anxiety disorders, particularly phobias and PTSD, by gradually exposing clients to feared situations. An example is where a person with a fear of flying gradually confronts their fear by starting with imagining flying, then progressing to watching videos of flights, and then eventually taking a flight. 7. Eye movement desensitization and reprocessing, EMDR. The focus is on reducing distress associated with traumatic memories. An example is where a person with PTSD follows the therapist's finger movements while recalling a traumatic event, helping to process and reduce the emotional impact. 8. Family therapy. The focus is on improving communication and resolving conflicts within a family system. An example is where the family works together to address issues such as parenting conflicts, communication problems, or behavioral issues in children. 9. Group therapy. The focus is on providing support and feedback from peers in a therapeutic setting. An example is where individuals with similar issues, such as addiction or grief, come together to share experiences and support each other under the guidance of a therapist. 10. Mindfulness-based cognitive therapy, MBCT. The focus is on combining mindfulness practices with cognitive therapy techniques. An example is where a person learns to observe their thoughts and feelings without judgment, helping to prevent relapse in depression. 11. Solution-focused brief therapy, SFBT. The focus is on finding solutions in the present time and exploring one's hope for the future. Here, an example is where a person focuses on their strengths and resources to create practical steps towards achieving specific goals. And lastly, 12. Play therapy. The focus is on using play to help children express emotions and resolve conflicts. An example is where a child uses dolls to reenact family dynamics, allowing the therapist to understand and address underlying issues. It must be noted that there are more therapy interventions than the ones discussed today. It is important to recognize that any therapy intervention that you choose has its own unique approach and techniques, which are tailored to meet the specific needs of the individual or group seeking help. Thanks for watching, and please like and subscribe to receive more videos like this one.